I want to talk about some of the conditions that you have seen be treated and overcome using the probiotics. I know that, you talk a lot about like leaky gut, and the evidence and the data behind that is pretty compelling. I mean, it's incredible. I also know I've been dealing with histamine intolerance, mast cell activation, and I know that Just Thrive is safe for individuals with histamine intolerance, which is also tricky, again, with different strains. Different strains can not be good for people with that histamine intolerance. So that's good to know, because so many people who listen to the show and so many people who follow me are dealing with this right now, which is crazy. And it makes you wonder, too, did this start in the gut? I'm working with different practitioners, and they're all like, you have to get your gut strong enough.
Yes. And yeah, I'm so glad you brought up the histamine intolerance, because you do see that with many of the lactobacilluses. They also contribute to the histamine. And so the spores do not. We know this about the spores, so that's why it would be fine to take it if you have histamine intolerance. It's a completely different category of probiotics. So even people who will take an antibiotic, for example, and doctor will say, well, don't take the probiotic while you're on the antibiotic because the antibiotic will kill the probiotic. Well, we've tested ours, and we know that they actually survive the presence of an antibiotic. We tested with people who were liver encephalitis patients. They were on some of the strongest antibiotics out there, and they found that these strains actually survive the presence of an antibiotic. So it would be a great probiotic to take in the presence of an antibiotic and afterwards, because we know if we're on an antibiotic, it wreaks havoc on your gut for up to a year, sometimes 2 years after being on an antibiotic. So you want to make sure you're continuing to support it by taking the spores. But the conditions, and that's what's so interesting, the conditions that are out there. I mean, we know that gas and bloating and diarrhea and constipation, those are certainly signs that we have some imbalance going on in our gut. So, but that's pretty obvious to people. What is not obvious to people is the gut-brain connection. And I think we've talked about it before, but and people are hearing about it, but it's really important to understand that our neurotransmitters like serotonin, dopamine, GABA are all produced in our gut, not in our brain like we've been kind of led to believe. It's 90% of our serotonin is produced in our gut. Dopamine is produced in our gut. GABA, which is our calming hormone, is produced in our gut.
So I love GABA.
I know. It's like, so calm.
Yeah.
So you have to take care of your gut microbiome to, have better mental clarity, you have better mental health. And then skin issues. We know that, that's how I got my kids to start the product, because they were in high school. My girls were in high school at the time. They started breaking out, and they were like, "Oh, this is amazing! How it helps! It's amazing when you start taking care of your gut. How your skin issues, rashes, eczema, psoriasis, acne, all of those things are directly related to the unhealth of your gut or the imbalance in your gut." And then, you talk about immune health. So autoimmune issues, but just overall immune health. 80% of our immune system's found in our gut lining. So when we're talking about autoimmune issues or allergies, anything like that. So it's really hard to find any non-communicable disease that's not associated with some type of imbalance in our gut health.
Do you recommend that people get a basic stool test or something like that to see where things are with their gut? Or how do they figure out exactly what's going on? Because I think that that's another thing that confuses a lot of people. And I've been there myself, where, you feel like things are off, your digestion is off, maybe you're experiencing bloating, maybe you have some anxiety, insomnia, some skin issues, these kind of non-specific symptoms. And then, we go and we're buying all of the supplements and just throwing things at it. Do you recommend assessing and then figuring out, getting a clear picture of what exactly is going on? Or is it just kind of safe to start with the probiotics, see if you experience any benefits? Is there an order at which you would do things?
I would love there to be a stool test that really represented our entire microbiome. Mm-hmm. Unfortunately, I think a lot of the stool tests out there are good, but just flawed. They don't show a true whole picture. They'll for example, I live in Chicago. So if someone went to the west side of Chicago versus the north side of Chicago, they would sample they would have a different experience in both of those areas of Chicago. So the same thing would happen with your gut, where they're not getting a true full picture of your gut microbiome. I mean, I'm sure it'll tell you something. So you might know you'll have some imbalance going on. But what they estimate, the experts out there are saying that 80% of the adult population has a leaky gut, and they just don't even know it. And what's so interesting is we did, University of North Texas did a double-blind human clinical trial on leaky gut or metabolic endotoxemia. And basically what they did is they took 100 college students and they tested them to see if they had a leaky gut. And the way you test that is unfortunately, it's not a test that we could get in a normal lab setting, but they could do it in a research setting. They tested to see if there were LPS toxins in the bloodstream. LPS stands for lipopolysaccharides. And when those LPS toxins are in your gut, they're not really problematic. It's when those LPS toxins seep into the bloodstream that we know we have this inflammatory response by the body. So our body is recognizing it as an invader because we don't want LPS toxins in our bloodstream and we don't want food particles in our bloodstream. So we could be eating kale and all these really healthy foods, nutrient-dense foods, but if those foods are in our bloodstream, they're known as an invader. They're not supposed to be there. So this study was done by University of North Texas. They took 100 college students and 55% of them had a leaky gut and didn't know it. These were healthy college students, no issues at all, healthy weight, healthy, everything was healthy about them. They had no known conditions, no medications. So what they did is they took that group that had leaky gut, they divided them in half, and they gave half of them the placebo and half of them the spores, the bacillus spores that are used in Just Thrive. The treated group, so the ones that were on those spores, actually saw a 42% reduction in LPS toxins seeping into the bloodstream. So that was huge. After 30 days, these college students had no dietary or lifestyle modifications during that 30 days. In the placebo group, they had no spores. They just went on, and they did the study on them, and after 30 days, and they saw a 32% increase in LPS toxins. And the problem with that is that when you have a leaky gut, it's like you have this drippy faucet. And it's like, people are like, oh my God, all of a sudden I have an autoimmune issue. Well, no, it really wasn't all of a sudden. It was like you've been dealing with it, or you're being overwhelmed on a regular basis with plastics and forever chemicals and antibiotics and glyphosate in our food. All of these offenders were being we're dealing with those on a regular basis. And then one day that drippy faucet overflows. And then you start having this autoimmune issue, or you start having allergies, or you start having anxiety or depression or whatever it might be, or skin issues. So it doesn't just happen all of a sudden. So I would argue that most people should be taking care of their gut. And there's other ways to take care of your gut besides taking a spore-based probiotic. I feel that the spore-based is a very effective approach, but it's one tool in the toolbox to start taking care of your gut health.
Mm-hmm. And tell me about the addition of antioxidants in it.
Yes.
What was the intention behind that?
I'm so glad that you mentioned that. So we actually didn't include antioxidants. What we've included is a spore strain called HU36 Bacillus indicus.
Okay.
That strain actually produces antioxidants in the gut. So when that strain gets to the gut, it starts producing antioxidants like astaxanthin, zeaxanthin, lycopene, beta-carotene, lutein. All these incredible antioxidants are being produced in the gut where they need to be absorbed. And a lot of antioxidants that you would just take, in a capsule or whatever, also have trouble absorbing and are surviving and getting into the gut. So the researchers at University of North Texas actually feel that antioxidant strain is one of the biggest reasons why we had such success with the sealing of the gut lining, because one of the biggest offenders of the leaky gut or one of the causes of leaky gut is oxidative stress. So now we have these antioxidants being produced right at the gut lining, and so helping combat that oxidative stress in the gut.
Mm-hmm. That's amazing.